Um, Greetings. Let's talk about another cytokine, which is the arachidonic acid. The reason we are covering this is because there's a lot of good drugs, pharmacology, medications that we get out of this mechanism, and so it's good to learn this mechanism. So essentially, you've got the cell wall, and once there's any injury to the cell wall, um, within the cell wall, there's a chemical which uh, uh, which gets processed by an enzyme called phospholipase A2, and that becomes arachidonic acid. That's this one here. Okay, so this is a byproduct of cell injury, and more specifically, cell wall injury. Okay. And once it does, there's a few things that can happen to the arachidonic pathway, arachidonic acid. So the arachidonic acid it usually activates inflammatory mediators or is pro-inflammatory. So it can be acted upon by two enzymes. One of them is cyclooxygenase, which is this one here. And the other one is uh, lipooxygenase, which is LOX, lipooxygenase or LOX, okay? And that gives us leukotrienes. So we'll start with the easy one, which is leukotrienes. What do leukotrienes do? Uh, so here you have your lungs, and its big function is bronchoconstriction. Okay, so again, you have the arachidonic acid, and it goes through two pathways, COX and LOX. LOX is lipooxygenase pathway, which gives us leukotrienes, which cause bronchoconstriction. COX COX is cyclooxygenase pathway. Now, the pathway actually has, is just not one or linear pathway. It's actually three components that are there. Okay. So there's a COX-1, there's an enzyme COX-2. Okay. And last but not the least, in the brain, we have COX-3. Okay. You have COX-3. Okay. So we'll start with the easy one, which is COX-3. So again, it's very specific to the brain and it causes fever and pain. So just like leukotrienes, COX-3 is simple. Okay. So let's talk a little bit about COX-1 and COX-2. Okay. So remember, you have the arachidonic acid, which then goes into the cyclooxygenase pathway, and there's two different areas of the pathway. One is COX-1 pathway, one is COX-2 pathways. So what does the COX-1 pathway do? Well, this is where it gets a little bit interesting. Both COX-1 and COX-2 uh, um, they cause pain, they cause fever, and they cause inflammation. Okay, so this is very, very important. So COX-1 and COX-2 both cause pain, fever, and inflammation. Additionally, COX-1 activates thromboxane A2. Okay, now right? This is thrombin causing. Thrombin causing. This is how I remember it. Okay. Thrombin causing. So it causes vasoconstriction and clumping of the platelets. Basically causes thrombus or clots. That's the way I think about it. That's the way I learn it. Okay. So COX-1 activates clotting. Okay. and it also activates the prostaglandin pathway. Okay, COX-2 does not impact thromboxane, but only impacts the prostaglandin pathway. Okay, this is an extremely important thing to know because when we talk about some of the drugs like NSAIDs, we're going to talk about COX-1 inhibitor, COX-2 inhibitor, or non-selective COX inhibitor. And that's where this is going to become a bit more tricky. Okay? But we need to know COX-1 impacts both the thromboxane and the prostaglandin pathway, and COX-2 just impacts the prostaglandin pathway. Now, thromboxane was easy, COX-3 was easy, leukotrienes was easy. Prostaglandins are numerous in number. And what I have done is I have simplified its study by including the ones that are most commonly used. Okay, the ones that are of very high clinical significance. And which ones are they? So they are prostaglandin I, which is prostacyclin. There's prostaglandin E1, prostaglandin E2, okay? And I have prostaglandin F, okay? And then I have prostaglandin E5. So there's a few of them, okay, that we are going to take a look at, okay? So let's start with prostacyclin I. Okay, now it's prostacyclin. Cycling the blood, keeping the blood moving. So remember thromboxane, thrombin causing vasoconstriction and clumping the platelets. Prostacyclin does the opposite. Cycling the blood, vasodilation, and decrease clumping of the platelets. That's the way I remember it. Okay, that's the way where it makes a lot of sense to me. Then you have prostaglandin E1 and E2. Prostaglandin E1, the way I remember it, is decreases inflammation. Okay, so smooth muscle relaxation is the uh, big thing that it does, and usually the two organs to think about are the penis and the cervix. And we'll talk more about this when we are looking at drugs. You have PGE2, that increases inflammation. So you have smooth muscle contraction. Okay. And again, uterus is one. And then the other one is the constriction of the blood vessels in the kidneys. So remember, you have afferent and efferent arterioles. So this is afferent, this is the blood coming in. And then this is efferent, blood going out. And this is the Bowman's capsule. Okay. So this is your nephron. So what is done? They usually have a blood go out at a high pressure, and then you squeeze out some of the components of the blood. And then you make it go through some tubules, you get things you want, you let go of things you don't want, and then that goes into your urine, and you micturate your urine or you pee it out. But that's essentially, this is the first step where the first pass is for the blood to go through an apparatus called the Bowman's capsule. So there's blood coming in through afferent A and blood going out through efferent. Okay, so afferent arterioles, they vasodilate when PGE2 acts on it. Okay, so there's more blood that comes through. Okay, okay, so if one inhibits PGE2, they're going to decrease the blood flow that comes to the kidneys. Okay, so this may cause issues with kidney, and we'll talk more about it because this is one of the big issues when we are giving people NSAIDs is their kidneys. Now, this is just a side note. What about efferent arterioles? Well, you have your angiotensin 2 receptor that controls that aspect of things. But like I said, we'll talk more about it in another lecture. So again, I have my thromboxane, right? And then I have my prostacyclin. So both of them are opposite to each other. Thromboxane, thrombin causing, causes vasoconstriction and clumping. Prostacyclin cycles the blood, vasodilation and platelet aggregation. And then you have PGE1 and PGE2. PGE1 is relaxing. So again, muscle relaxation, smooth muscle relaxation. And then the other one we didn't talk about was stomach acid. So again, when you're resting and digesting, you want more stomach acid to be produced. So that's PGE1. So that's what I would think about. Okay, and then PGE2 is smooth muscle contraction, so like muscle of the uterus. And then the other thing that PGE2 does is it vasodilates the blood vessel that's coming into the Bowman's capsule in the kidney. So it increases the blood flow. So anything that blocks this will vasoconstrict the blood vessel that's coming into the Bowman's capsule or decrease the blood that's coming into the Bowman's capsule and affect the glomerular filtration rate. Okay, so we covered, the three prostaglandins. Now there's a couple of more. There's a PGF, and the big role of PGF is uterine contraction. Okay, and then last but not the least is PGE5, which what it does is it vasoconstricts, and it does it by stopping or blocking nitrous oxide. Nitrous oxide is a vasodilator, and PGE5 inhibits production of nitrous oxide. Thus, it vasoconstricts. Okay, perfect. So again, this is kind of a map which is slightly bigger, but let's see if we can review it and review it well. Okay, let's see if we can review this and review this well. Okay, so let's see if we can. Okay, so what did we cover in this lecture? Real quick, we talked about how arachidonic acid, which is pro-inflammatory, is produced through an enzyme called phospholipase A2, and then how it goes into two pathways. That arachidonic acid gets transformed with a lipooxygenase enzyme into leukotrienes, which causes bronchoconstriction. Okay, or it can go get processed by the cyclooxygenase enzyme and goes into cyclooxygenase pathway. Now that pathway's got three subcomponents in there. The easy one is COX-3, which acts on the brain and gives fever and pain. Acts on the brain, gives fever and pain. I'm rhyming today. The other two are COX-1 and COX-2. Both of them give you fever, pain, and inflammation. Okay. However, they've got some other specific function. COX-1 acts on thromboxane A2 and prostaglandin, and then COX-2 just acts on prostaglandin pathways. Okay. Now, thromboxane is thrombin causing, vasoconstriction, and clumping of the platelets. And also COX-1 acts on prostaglandin. Okay. COX-2 just acts on prostaglandins, and there's a few of them. First one is PGI. It's also called prostacyclin. It's cycling the blood. It's opposite to thromboxane. Decreased platelet aggregation and vasodilation. Okay. Then we come to PGE1 and PGE2. One of them causes smooth muscle relaxation of penis and cervix and some of the other smooth muscles, and increases stomach acid because you're resting and digesting, and this is the way I remember it. PGE2 is more pro-inflammatory, causes more contraction of the smooth muscles like the uterus. But additionally, and interestingly, it vasodilates the afferent arteriole of the kidneys, which increases the blood flow. okay, which increases the blood flow in the kidneys, okay? And then the last two, which are noteworthy, are PGF, which causes uterine contraction, and then PGE5 that causes vasoconstriction by inhibiting nitrous oxide.